In my training as an eye surgeon in 1990 through 1993, a modern technique was evolved from a fellow named Kellman out of New York, using a tiny little instrument that could be inserted into the eye using ultrasound to break your hard cataract lens out of the eye into small fragments and then vacuum them out of the eye. This was called phacoemulsification. And the phacoemulsification technique required a whole new skill set that surgeons at the time simply didn't have. And in my estimation, we have a generation of doctors, basically, that have happened since then that have had to get better and better at using this new technology. And I'm lucky enough to have been the first generation to start right out of my training doing this technique. So when I started in practice in the south side of Chicago in the early 1990s, I was one of the few surgeons down there that had skill to do this particular new technique. And so the job I took, there was literally a backlog of thousands of patients who needed this surgery. And so I got the opportunity to perform thousands of these procedures over that decade. And some days I'd perform 30 procedures. I'd have these done by 1 o'clock in the afternoon. So we'd start at 6:30 in the morning. By 1 o'clock in the afternoon, I'd have 30 patients treated. And what one gains from that is not just the pride in saying, oh, I treated 30 patients, but it's the experience of having been over and over and over again into lots and lots of eyes that will show you the myriad of possibilities that can happen when one enters into this prospect of trying to remove cataracts by this method. And so what one develops is a bit of an instinctual sense of like, wow, this eye doesn't go the way normal eyes do. Something's a little different here. And I still carry that with me today. The total number of procedures I performed, can't even tell you the number. It's thousands. And I will tell you that the skill set I have, one continues to get better and better at. There's no question that in my line of work, you always are looking to improve your technique, to find new ways, new subtleties that will help us. I'm Dr. Richard Foulkes. If you'd like to learn more about cataract surgery, call our phone number, 630-724-1400, or go to our extremely informative website, www.glassesfree.com. And remember, there's no charge for your initial consultation.